Welcome to our 5 on 5. We're pleased to be joined by Jennifer Lynn, the CEO of Jackson Care Connect. Jennifer, good to see you again. How are you today?
I'm well. Thanks for having me.
So in case anybody is unfamiliar with Jackson Care Connect as a CCO, tell us about yourself.
Great.
The organization.
So CCO is a coordinated care organization. We are the administrators of OHP. So we ensure over 30,000 members here in Jackson County and make sure they have adequate coverage for all their medical, mental, and oral health needs that they might have.
Okay, and beyond obviously the many medical sides of that, you guys do a lot more in the community outside of that traditional healthcare realm, if you will.
We really do. It's why I feel lucky and honored to have the job that I do. We're a nonprofit, community-based organization, and our goal is to improve health, not just improve the business of healthcare. So that means that we're always looking for opportunities to invest in things that will really change the lives and the community that we live in so that we can all be healthier in our own quests. Okay. Sometimes that does mean that we're working with a hospital or a clinic or a service provider, and we're either helping them increase access to their services or maybe address a specific need that one of our members has. Sometimes that means that we're supporting our members directly to make deep and meaningful changes in their lives. And sometimes it means that we're investing in more community-based programs that are really changing the community we all live in.
Can you give us some examples of some of those different things that you guys are doing in the community?
I can. So let me start by saying we are a really small organization and we run lean intentionally. Our goal is not to spend these community dollars on our own organization, but to really partner with the organizations that already exist here in Jackson County and are serving all of our citizens' needs. So that means that we're looking for deep and meaningful partnerships. And those partnerships allow us to do a lot more for the members that we serve. So some great examples that we have are a partnership that we're starting with the Ashland Police Department. They're actually asking police officers to enter what they call a gateway program. So if they encounter or arrest someone on the street who seems to have an alcohol or drugs abuse problem, they now are able to consider the health impacts of what that person is going through. And they can bring them to the Ashland Community Hospital, a neutral site, and connect them with a substance abuse counselor where that person can now start to enter treatment for their problem rather than being arrested and put into jail. So it gives them a new way to approach some of the people that live in Ashland.
Okay.
We have another partnership that is with the Family Nurturing Center. It's our relief nursery and On Track, and it's for women, mothers really, who have substance abuse issues and are working on those and really working to change their lives. They get to go do gardening. And in addition to learning how to garden and some life skills there, they're really building community, they're connecting with their kids in a very different way, and they're having a joyful experience, and we've heard that it's turned lives around.
Wow.
We also have a lot of other partnerships on this wellness idea. We're working with the YMCAs both in Ashland and in Medford. We have over 10,000 visits a month of Jackson Care Connect members in those gyms because we subsidize membership for any member who would like that.
Wow.
And that gives them, obviously, they can work out, they get the gym and the fitness, but they also get friends, they get fun, and they get access to childcare.
Quality of life.
Quality of life. And what we're really finding is that it's about the social connections we have, much more than the medical care that we're able to have.
Wow, so it certainly sounds like it's paying off. What comes next for Jackson Care Connect? How do you guys continue to grow the organization, improve the health of your members?
Great. So it is paying off. We've invested over $9 million just last year locally here in Jackson County for both health and health care. It's a pretty phenomenal impact that that's had. And we hear stories from our members all the time. People who have lost more than 50 pounds, have broken out of their shell, are doing things they never thought they would do before, and then their kids are seeing them do that, and their kids are doing the same.
Wonderful.
People who've gotten their kids back from the foster care system, lives that are deeply, deeply changed. And I want to say that the whole country is really watching what's happening, both in Oregon as we lead our way in thinking about health and not just health care, but also here in Jackson County and what Jackson Care Connect is doing. We often are getting calls from folks all around the nation wanting to research and understand and come out and get a glimpse into what it is we're doing for our community here.
Very nice. Well, it was great to meet you. Thank you so much for being here.
Yeah.
Sounds like there's a lot going on that
Thank you. It's a privilege.
To be proud of. Thank you very much.
Yeah.
Stay with us. We'll be right back.